Sprained ankle. What to do? Sprained ankles are a common injury. They happen if your ankle rolls in or out suddenly. This abrupt movement causes the ankle joint to move out of place. An inward ankle roll is called an eversion sprain. This type of injury affects the ligaments and tendons along the inner part of the ankle. An outward ankle roll is called an inversion sprain. Inversion sprains affect the outside ankle ligaments. Ligaments are strong fibrous tissues that connect the bones of the ankle to the bones of the leg. Both eversion and inversion sprains cause the ankle ligaments to stretch or tear. See your doctor if you had the symptoms: extreme pain, odd shape, severe swelling, inability to walk more than a few steps, limited range of motion. Should I use rice for my ankle sprain? Mild sprains can often be treated at home. The traditional rice method, rest, ice, compression, elevation, was once considered tried and true, but it may not always be your quickest route to recovery. Rest or activity? Mild exercise may help speed recovery after resting for a period of 1 or 2 days. A gentle exercise is good for blood flow and that it helps speed up healing. Exercises that strengthen muscles in the calf and ankle can be helpful for improving balance and stability, reducing the risk of re-injury. Immobilizing a sprained ankle with a brace for up to 10 days may help decrease swelling and pain. But completely immobilizing an injury for more than 4 weeks may actually worsen symptoms and affect recovery negatively. Start with gentle strengthening exercises. Don't continue with any exercise that seems to aggravate your symptoms. Talk to your doctor or physical therapist about the types of exercise that might be beneficial for you. Ice or heat. Every injury is different, and rice is still widely recommended. If icing your sprained ankle provides relief, do it. Use an ice pack for 15 to 20 minutes every 2 to 3 hours for the first 72 hours. This may not be appropriate for people with health conditions such as diabetes, damage to the peripheral nervous system, peripheral neuropathy, or vascular disease. Don't ice your ankle for more than 20 minutes at a time. More does not equal better in the case of applying ice. Compression. Compression helps decrease swelling and provides stability to your ankle by immobilizing it. You should apply a compression bandage as soon as a sprain occurs. Wrap your ankle with an elastic bandage, such as an ACE bandage, and leave it on for 48 to 72 hours. Wrap the bandage snugly, but not tightly. Elevation. Elevating your foot above your waist or heart reduces swelling by promoting elimination of excess fluid. Keep your foot in an elevated position as much as possible, especially in the first few days. Anti-inflammatory medication. Non-steroidal anti-inflammatory drugs, NSAIDs, may be most effective if you use them during the 48-hour window after you sprain your ankle. While pills like ibuprofen or naproxen may be the first anti-inflammatory medication to come to mind, there are also topical options that you can rub or spray directly over the site of pain and swelling. Topical NSAIDs can be just as effective as the NSAIDs you take orally. NSAID gels might also be a good option if you tend to experience common side effects from NSAID pills, like an upset stomach. Ankle exercises and stretches after a sprain. Certain exercises can rehabilitate your ankle. Your doctor or physical therapist may recommend a series of movements designed to restore strength to the area, so you avoid future sprains. Here are a few exercises to try when you are able. Walk, either with or without crutches. Trace the alphabet with your toe. This encourages ankle movement in all directions. Stand on one leg for 25 seconds to 1 minute to improve strength. Sit on a chair with the foot of the affected leg flat on the floor. Move your knee from side to side, while keeping your foot flat. Do this for 2 to 3 minutes. Stretch your calf by placing your hands flat on a wall and positioning the injured leg behind you. Straighten the leg and hold for 25 seconds. Do this 2 to 4 times.